Alvin Tarlov, director of the Texas Institute for Society and Health, explained that there are 5 major categories that influence health: genes and associated biology, health behaviors such as dietary habits, tobacco, alcohol and drug use, and physical fitness, medical care and public health services, the ecology of all living things, and social and societal characteristics. Despite all that we have come to understand, we have yet to fully appreciate one major category: the ecology of all living things. It's true that we study in great detail the life cycle of mosquitoes and are applying greater attention to environmental changes, but we have always overlooked and continue to overlook a significant facet of human existence that has prevailed since our beginning: our relationship and treatment of other animals. Today, food security issues, limited healthcare resources, unsustainable consumption patterns, environmental degradation, bioterrorism, global warming, human population growth, obesity, novel infectious diseases, world hunger and violence are now emerging as the most urgent public health issues we face. The complexity and roots of these issues necessitate a public health strategy that goes well beyond the health sector. We have started to do this. Due to a recent and significant change in our climate, for example, the fields of public health and medicine have begun to acknowledge that how we treat our planet affects our health. To fully tackle these urgent issues head-on, we must also acknowledge that many of them are linked to how we treat other animals. It's overly simplistic and inaccurate to say that every human and animal encounter that is connected with human illness is a result of our actions or is avoidable. Yet, a significant proportion of these connections are, at least in part, a result directly or indirectly of our disregard for the welfare of animals. Companion animals are increasingly viewed as a family member with inherent worth. More than 70% of U.S. households with young children have companion animals. In one study, 7 to 10-year-old children named on average 2 companion animals each when listing the 10 most important individuals in their lives. When asked, "Whom do you turn to when you're feeling sad, angry, happy, or wanting to share a secret?" nearly half of the 5-year-old children in another study mentioned their companion animals. Harm to companion animals can cause tremendous grief and anxiety in those who care for them. Unfortunately, their status as family members renders companion animals vulnerable to abuse, often as a means to exert control or intimidation over other humans. For example, an abusive father may hurt the family dog in order to scare his spouse or children into submission. The trade is directly and indirectly leading to a rapid rise in new infectious diseases, the spread of existing diseases, injuries in people, and the loss of species at the rate never seen before. As we delve deeper into the world's forests and jungles to capture, kill, and collect animals for trade, we are inviting pathogens never before encountered to jump into the human population and wreak havoc. As we rip animals from their natural habitats, we're disrupting ecosystems in a profound and perhaps irreversible way, which will in turn cause a surge in some very deadly infectious diseases. And as we ship billions of animals around the globe, we're ensuring that any disease unleashed by this trade will impact humans everywhere. Humans are consuming more animals than ever before. Once viewed as a luxury, meat is now becoming a dietary staple for many due to a worldwide growth in urbanized populations and affluence. Today, more than 64 billion animals are raised and killed for food worldwide annually. This means that more than 9 farmed animals exist for every human at one time. China and the USA are one of the most largest farm animal producers in the world. In the US alone, an excess of 9 billion land animals are slaughtered annually for food, approximately 1 million per hour. Let that sink in. 1 million animals are slaughtered every hour in the US. On average, each American eats an equivalent of 21,000 animals in her or his lifetime, and global meat production is expected to double by 2020. Over the last half-century, a dramatic shift has taken place in the animal agriculture industry and may represent the most profound change in the relationship between humans and animals since animals were first domesticated. Perhaps the most significant of all, public health must recognize the animal-human abuse connection. Most of the largest health agencies, such as the World Health Organizations or the U.S. Centers for Disease Control and Prevention, do not make any reference to the connection between violence against animals and that against women and children in their reports on domestic violence and child abuse, and this needs to change. To help prevent both animal and human cruelty, public health can promote and support programs designed to cultivate empathy for animals. A lack of empathy is closely linked to the abuse of animals. A well-developed sense of empathy, on the other hand, corresponds with healthy emotional development in children, and research demonstrates a link between empathy directed towards humans and animals in both children and adults. Public health can also urge the enactment and enforcement of stronger animal cruelty laws, including laws against animal fighting and other types of abuse. Animal cruelty should become a more integrated part of public health education. Currently, with the exception of a brief mention of animal cruelty as a sign of antisocial personality disorder or conduct disorder, animal cruelty is not routinely discussed in medical or public health trainings. And practitioners should be trained to recognize potential animal cruelty being witnessed or inflicted by their patients and be instructed in ways to notify the proper authorities and coordinate with social welfare institutions. We can all do these things today. In fact, we're at an amazing crossroads in human history. We can largely exist, and even more, exist better without compromising the welfare of animals. Curtailing our harmful practices against animals will significantly reduce a great many of the problems that currently threaten our health and welfare.